The principal objective of the article is analyzes patients in critical conditions due to acute brain injuries and their interaction with the respiratory system and with the central nervous system, which highlights mechanical ventilations and how it influences intracranial pressure and blood flow in the brain through different ventilation strategies that can help these patients to evolve satisfactorily.
The authors of this article are Fritz Bolvers and the Department of Anesthesia and Intensive Care University Hospital of Northern Norway, as well as the Department of Medicine Clinical, Ut Norwegian Arctic University Tromsø, Norway. Coppola and Shimuelo live in Milan, Italy, and currently work on the Department of Anesthesia and Intensive Care, ACCT Santi Paolo Carlo, and the Department of Health Science, University of Milan. In addition, they participate in Coordination Research Center. Herman lived in Tours, France, worked in intensive care medicine reanimation, CIC in the 1415, as also on the Center de this Pathology Respiratory University de Tours. Claude Guerin, he is graduate in medicine in Lyon and professor of intensive care medicine, Faculty of Medicine Lyon at University Claude Bernard Lyon, Francis, currently consultant professor in the medical usage and the Edward Herriot Hospital, Hospital SIP, and Lyon, France, and research associated the Macon Street Labs, McGill University, Montreal, Canada.
Some of the managed strategies protect ventilation, PPV, in which PEEP, BT, and intracranial pressure, ICP. Parameters are optimized. He highlights that the prone position is the most beneficial for patients with moderate or severe ARDS. However, caution should be exercised in use with venous routine ICP, as they may be adversely affected. He also mentions winning after MV, which may daily rehabilitation and discharge in an ICU, along with the possible consequence this may handle. Finally, he emphasizes the need for clinical studies to optimize ventilation strategies in this population with individualized approaches.
The literature has examined the connection between brain injury and ventilatory capacity, revealing how the interaction between the brain and the lungs can influence their structure in affected patients. Key aspects include managing intracranial pressure and implementing lung proactive strategies. It is also highlighted that ventilators can impact cerebral blood flow, while ventilatory pressures can modify venous return, thereby affecting ICP. Additionally, ventilation plays a crucial role in patients with acute respiratory distress syndrome and brain injury, considering factors like permittive hypercapnia and the active states, both which influence oxygenation and ICP.
How has the article broadened your understanding of the topic? The article has broadened my understanding of the topic have. The need to implement launch protective ventilation strategies to minimize launch damage in different gauge chains with Ali. Here's the crucial has hit against of to not have primary respiratory indication but may require prolonged mechanical ventilation.
Among the new ideas obtained regarding the subject, we can say that it is of vital importance to carry out a more personalized treatment that is adapted to each patient, causing the best possible balance in the protections of the lung and the brain. Using optimal ventilation, thus reducing pulmonary and brain complications in patients with acute brain injury, we have the idea of using mild hypocapnia in some patients with elevated intracranial pressure during neurosurgery, allowing a significant decrease in ICP and not worsening brain energy metabolism in acute situations.
The management of respiratory challenges and in patients with acute brain injury is a crucial focus in physical therapy education, particularly in respiratory rehabilitation and critical care. This article explores essential aspects tied to professional practice and the expertise gained during training. It begins by emphasizing the importance of understanding respiratory anatomy and psychology, and brain injuries can profoundly impact lung function. Such knowledge enables the implementation of effective therapeutic interventions to enhance respiratory performance.
Number one, why it's important to initiate intratracheal intubation and the appropriate use of invasive mechanical ventilation in the parent while brown in the of is the using events after the period on the time. Number 2. Do you think is the important to monitor protect ventilation parameters against invasive mechanical ventilation in a point while brown in your and the ears endotracheal pressure? Number 3. Why is important to protection P in the pair 2 in endotracheal intubation to the harm IPC.
Respiratory genes and ventilator imaging in the different types of acquired brain injury patients. The article stage as acute brain injury is the show that event produces respiratory decline, brain damage, and the reduced perfusion, which is regulative cerebral autoregulation in an altered B change is carbon dioxide pressure. It leads to decreased illness due to the two chain is lung volume, increasing intracranial pressure, which produces a massive neuronal sympathetic discharge into the pulmonar and system vasoconstrictor, deterioration of vascular periphery, promoting pulmonary edema. Other effects are dysregulation of the respiratory centers due to damage in the brain's mass effects due to cerebral hemorrhage that causes a deterioration of nerve impulse. There is also in acquired lung injury shows as acute respiratory distress syndrome, pulmonary neurosis, which cause traumatic brain injury, among others, and there are also several subtypes. Traumatic brain injury, suprathecal hemorrhagic, intracranial hemorrhagic, and ischemic hypoxic brain injury. They also indicated that some parents are out to brain on their own and the range of oxygen subtly is uncertain. The before hypercamness is due for acute episode of fear intracranial pressure and invasive mechanical ventilator will be used to pull an assistant because was stupid there are risks of reintubation. Also show on the factors and the affecting wind and the whole deal increase there's risk and a long-term physical, psychological and cognitive complication.